Hello and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, where I'm looking to teach dentists to be more profitable by putting patients first. Now, how can you tell? Are you putting patients first? Well, I believe strongly that putting patients first is what grows practices, so strongly that I wrote a book about it. Patient First Manifesto. If you don't have a copy, get one. There'll be a link around this podcast somewhere around here. You can get it for free. But I believe strongly, obviously, and I created a podcast called the Patient First Podcast. That is how, in today's world, practices can grow. So how do you know if you're growing? Without talking to your accountant, without going to your bank account, without looking in your dental software or your accounting software, without even talking to your office manager. How can you tell that you're putting patients first today? Well, I think there's a simple way to do it. Ask yourself one question. That question is, when was the last time that you were forced to expand the capacity of your practice? Now, the only option here, if you're growing and you don't expand, is to have massive delays in people coming to see you. So you'll either lose patients, so you don't have to expand because you've just not actively cultivated your business to what it needs at that time, which a lot of dentists are probably doing, or you've effectively addressed the need to expand by reducing your demand, by increasing your fees, by dropping insurances. But frankly, the dentists that I've talked to that have increased their fees and dropped insurances, very few who are putting patients first actually lose their patients because of that. So they still have the need to expand. I hope you caught that. I think that in dentistry, if you are putting patients first and you are growing, you will probably either have to expand, or if you don't address that expansion, you will address it by having people not show up to your practice anymore. So it's an important question to ask yourself. When was the last time you needed to expand? Well, when I look at this, I think a lot of you are probably thinking, I probably had to expand my practice a decade ago. But let's do some math. As we are wont to do on the Patient First podcast, I like to pull up the ye old iPad, and then we can do a little bit of math together so that we can see and prove out the fact you'll have to expand your practice if you're putting patients first. So if you see net, well, let's just start off by saying, let's say you get 25 new patients a month, which is not rock star status, by the way. That is probably completely doable for any practice in any community, if that's growing at all. Let's call it 25 new patients a month, just sort of because I think that's probably around what the average practice gets. The practice upstairs that I'm fractional owner of, I'm not even really involved with anymore to much degree, it's about 120 new patients a month, and there's 4 dentists, so you can do the math there. But let's talk about like an average practice getting 25 new patients a month. Well, I'm going to say that this practice doesn't even do a great job of putting patients first. This practice kind of doesn't focus on the experience at all. They don't really have somebody at the front desk that cares about people that much, frankly. And so they're losing 10 patients every month due to leakage. Patients moving, patients getting mad at the front desk because of no financial arrangements or whatever, but they're netting 15 new patients every month per the dentist. So let's say there's 2 dentists, you just double the numbers, right? So this practice per dentist is getting 15 new patients every month. So what if that's every month they're getting 15 new patients? That means that over the course of a year or 12 months, they are getting 180 new patients every year. Now, my math is wrong, or if I'm missing out on something here, please comment below. If you like what I'm doing, subscribe. Our subscription numbers are going great. Our views have gone off the charts. It's been so much fun to hear your comments. And I could easily be missing out on something here. So please, if I'm missing something, you'd like to add a detail, please comment below. I do read your comments. I love them. They're great. So let's say I'm doing this right, and you get 15 net new patients per month. Over the course of a year, it's 180 new patients. So over the course of 5 years, which goes by like that, you will have with 900 extra net new patients. Now, why is this significant? Well, the average dentist only sees about twice this number of patients, right? So that means that 50% of your practice for the average practice is growing every 5 years. Every 5 years. So every 5 years that go by so quick, it's like your kid going through college. Hopefully your kid's going through college a little quicker than that. But every 5 years, 50% of the patient volume is being added to your practice. So that doesn't mean if you've been practicing for 15 years, you should even be able to handle the volume. And I have lived that. So for those of you that know a little bit about my story, let me turn off my iPad here. I started off in a strip mall that was 800 square feet. Over the course of the 20 years that I had my practice, we then moved into the medical center in a third floor, buried. Nobody could find us. And then we moved to the building that we're in now, where the practice takes up the top 2 floors, and the technology companies and Upgrade Dental take over the lower level. And what made me think about this is we need to expand again. I'm actually buying an office condo a couple blocks away, where we're tripling the size of Upgrade. So you'll probably see me with a different background and some new equipment in a few months. But the reason why we're doing that is because the practice is growing too. So we're actually going to be taking over another level of the building. When we moved from that medical center to this building, we were just on the top floor, and now the practice is going to take over all 3 floors. So, and Upgrade and the tech companies are going well too. So lots of innovation, lots of education to come. But it made me think, like, well, I've had to manage capacity my entire career. And I think that a lot of dental practices stay the same 4 chairs for 25 years. And it's often because they're probably either they're not putting patients first, or so they're not growing, or they are ignoring the fact that they have this increased demand, and they're limiting it artificially by not growing their practices. That is problematic, I believe. I think you should manage that so you can grow your practice, so you can see more patients. The practices, the dentists that are taking care of patients well, putting them first, doing high quality care, I think deserve and should grow so that they can positively affect more patients. So please do that. Thank you very much for showing up, for being an engaged member of the dental community. I appreciate it very much, and looking forward very much to seeing you next week on the Patient First Podcast.